place where they can practice in a safe environment. So this is simply a recreation of a hospital environment or a home environment, and we are able to, with a high degree of realism, have a situation play out and the students practice it ahead of time. So when they go into a real clinical setting, then they've already encountered this and they've developed the skills and know how to react and what to do to save lives. So the skills that we focus on in simulation are cognitive skills. They're the skills of walking into a room and noticing what's wrong immediately. They're the skills of adding up 2 or 3 different symptoms or problems that you've found and knowing what does that mean and being able to communicate that to a healthcare provider.
The simulations we do are actually based on real patients, so everything has a real life applicable concept to it.
In the sim lab, students get to practice the skills and techniques that you use in nursing or in other healthcare applications. And you get to do that in an environment that is safe for the student and it's safe for the patient. We run a mix of mannequin-based sims as well as standardized patient-based sims. So sometimes you're working with the mannequin that you do physical tasks on, like drawing labs, starting IVs, placing catheters. And sometimes you work with our actors, these simulated patients, and they're great for communication and body language and education. So you get that mix, and sometimes we have both of them together, and you've got to do both physical skills and simulated patient skills. We have 3 separate patient rooms, and we can set those up any number of ways. We can set them up to be acute care hospital rooms, they can be clinic offices, they can be patient apartments, so you can learn how to conduct yourself during a home health visit. They can be a mental health facility. We get really creative with how we set up our environment.
We make it as realistic as possible. I run simulations, so I really work with the robots or the mannequins. Sometimes I'll act as a patient. I also assist in other programs outside of the nursing program, so we've actually brought mannequins down to the Hibble Center for the exercise science students to look and take a blood pressure and listen.
We also have a full medication room supply room, which is really close to a hospital's supply room. So the students need to learn the equipment and how to organize getting all the correct equipment in an appropriate time and bring it to the room in a correct fashion. We don't just hand them everything they need. They have to think through that process as well. After the simulation, we bring you to debrief and we talk about what went well and what did not go well and what you would improve next time. We have a full audio-visual recording suite in all the rooms in the sim lab. So not only do you learn in the moment of the actual simulation, but you have a recording of that event. So you can go back and you can look at your body language and your technique and your performance.
The simulations are leveled according to the course. So each course has a set of simulations that are helping the students apply the knowledge that they've learned in that course. So we have a pharmacology course, and I think we're probably the only nursing program that has pharmacology simulations where the students get to explain to our actors how their medications work and what the side effects are.
Some of our more complex skills that you get in your senior year, we do labor and delivery, and we have a mannequin that actually is pregnant with a baby mannequin, and you have to deliver the baby mannequin and then take care of mom and baby. We also run code blue scenarios where the patient's heart stops and the students have to do CPR and perform really ACLS code blue scenario where they're giving medications, they're giving electric shocks through a defibrillator, and really function as a team of 6 to bring that patient back. And that's probably our most complex skill set, and that's one of the last sims that they do because they're at the peak at that point.
I think some of the best things they take away from sim is probably going to be interpersonal communication and patient bedside manner. I would say that's probably the top because the skills should follow along with it. Some students are really, really good at like tactile skill, but they lack in the patient bedside manner. And SimLab actually forces you to be good at both.
We give you experience. Take some of that stress off and really perfect your skill before you're asked to do it in a real scenario.
That's why I'm in simulation, because to me, if you're giving me a textbook to learn something, or you're having me walk into a patient room and practice it, I would far rather try it hands-on. And I think our students are like that as well, that you can learn knowledge, but it's really important to be able to walk into a situation and apply that knowledge, and then have the immediate feedback of the patient getting better, or if you didn't do something, the patient may get worse. And that is a huge advantage to learning with direct application and with the coaching of your faculty that are watching you and giving you feedback after each interaction with the patient.